Yes, my name is DeJaris Campbell. I'm 54, and I'm a breast cancer survivor.
My name is William Campbell. I'm 55, and I'm a bladder cancer survivor.
You have to determine which bill you're going to pay, whether it be your medicine or are we going to have lights. I mean, that is a good thing when you don't have to worry about such a thing. And Team Continuum has helped us so much.
There are so many issues financially when you're diagnosed. You are faced with insurance issues, work issues. There's just an enormous burden placed upon the patient. I think when you give a grant like Team Continuum does, it's for practical purposes. People want to bring you flowers, they want to buy you chocolates. It doesn't pay the bills. And when you're fighting for your life and you're busy negotiating with hospitals and doctors and appointments, knowing that one less burden is on you is huge.
My social worker at Mount Sinai Hospital, I had a conversation with her about financial issues in which my rent was involved. And there wasn't any place that was actually paying other items other than medical or medications. And she suggested that I put in an application for Team Continuum. It allowed me to utilize funds to pay other bills that were not covered by medical organizations that covered medical and medicines. For me, and I am sure for a lot of other families, that to have flexibility of funding is something that the families need. It's required, and I believe Team Continuum understands that.
So many of our patients are unable to work during their cancer treatment, and they're really facing challenges meeting their bills, such as Con Edison bills, utility bills, rent. And so they come to the social workers in a lot of distress, saying that they're unable to keep up with their finances since they've been sick, they get less wages, or they're unable to work. And so one of the ways that we provide them with assistance is to refer them to agencies like Team Continuum to try to get some of those bills paid for them. So many patients that you've helped over the years that I've been making referrals. A recent example was a patient who was facing an eviction. She was unable to continue working due to her cancer treatment, and she was starting to go through the eviction process. And when I made the referral, and then Team Continuum came through to help her with some of her rent and some of her back rent, and she was able to continue to live there. And so I think that for her made such a huge difference to her life, because she was facing being homeless on top of going through cancer treatment. And I think what Team Continuum provided her was a chance to continue to live and have her quality of life and not to worry and deal with the stress of facing homelessness at the time when she really needed to focus on her health. So Nancy, our social worker, sees the breast cancer and the GYN cancer patients, and the Roosevelt nutritionist sees all of the outpatient cancer centers that need a nutritionist consult. Nancy is responsible for providing psychosocial support. She helps patients with their concrete needs. So the funding really allows her to reach a number of patients and to help them with coping with their illness and connecting them to resources that help them through the disease. I think it's really important to fund Team Continuum in an organization like Team Continuum, because unlike a lot of the other cancer research programs or other cancer nonprofits, Team Continuum is really helping the patients who need money. They're helping patients, and the patients are directly benefiting from that support. And it's not to say that there aren't other great organizations, but this organization, and I can truly attest for that, is really helping the patients in need. And as a social worker who's making a referral, there's really not that many organizations that we can turn to, unfortunately, anymore. And there's, I would say, less than, I can't even think of more than 2 at most. So Team Continuum is really filling that need, and it's a huge need.
It's families like ours. I mean, in our situation, it's a little hard because both of us are dealing with cancer. However, there's so many people that need this same exact help. And I would say, please, if you have the financial ability to give to Team Continuum.
It's important and it's needed. And I think more people need to get involved. And if people want to help, this is a very practical way to do it, and you actually see the results.
The benefit is enormous to families, and I know it was for mine.